Imagine a world where a computer can look at a patient and predict their risk of disease faster than any human doctor. For centuries, humans have relied on doctors to diagnose illnesses based on symptoms, tests, and experience. But diagnosing a disease is often like finding a needle in a haystack of complex medical information. Every patient generates a massive amount of data, from lab tests to imaging scans to years of medical history. Even the most skilled doctors can struggle to see patterns hidden deep in these vast data sets. Artificial intelligence, or AI, offers a new way to approach this challenge. AI systems can analyze enormous amounts of data in seconds, far faster than a human mind ever could. They use patterns in past medical records to learn what different diseases look like. Machine learning algorithms are a common form of AI in medicine, teaching computers to recognize these patterns. These systems improve over time as they see more examples, much like a human learning from experience. AI can detect subtle signs in imaging scans, like tiny tumors or unusual tissue changes that might escape a doctor's eye. It can also analyze lab results to spot early warning signs of conditions like diabetes or heart disease. By combining multiple sources of data, AI can create a more complete picture of a patient's health. In some cases, these systems have already outperformed human doctors in specific diagnostic tasks. For example, AI can identify certain types of cancer in imaging scans with higher accuracy than average radiologists. This doesn't mean AI is replacing doctors, but rather enhancing their abilities. Doctors provide context, intuition, and ethical judgment that AI cannot replicate. AI is particularly useful in situations where speed is critical, like detecting strokes or heart attacks. It can also assist in resource-limited settings, where experienced specialists are scarce. By flagging high-risk patients early, AI can help prevent diseases from progressing. This early detection can lead to treatments that are more effective and less invasive. AI can also reduce human error, which is a significant factor in misdiagnoses worldwide. Even small improvements in diagnostic accuracy can save thousands of lives each year. Medical imaging is one of the areas where AI has made the most visible impact. Algorithms can analyze X-rays, MRIs, and CT scans in a fraction of the time it takes humans. They can highlight anomalies, suggest likely diagnoses, and prioritize urgent cases. This allows doctors to focus their attention where it matters most. AI can also be trained to recognize rare diseases that doctors might only encounter a few times in their career. These systems can compare a patient's data with thousands of similar cases to find matches. By learning from global medical databases, AI has access to far more experience than any single doctor. Natural language processing enables AI to read and interpret patient records and research papers efficiently. It can summarize the most relevant information, saving doctors hours of manual work. AI can even assist in predicting how a disease might progress in a patient over time. This predictive ability can guide treatment decisions and improve patient outcomes. Some AI systems can suggest personalized treatment plans based on a patient's unique characteristics. By tailoring care to individuals, medicine becomes more precise and effective. These tools also help hospitals manage large numbers of patients more efficiently. AI can schedule tests, prioritize urgent cases, and flag potential complications. This kind of support reduces the burden on healthcare professionals. It also helps make medical care more equitable, especially in regions with few specialists. Despite these advantages, AI is not without limitations. Algorithms are only as good as the data they are trained on, and biased data can lead to biased results. Errors in data collection or labeling can produce incorrect diagnoses. AI also cannot fully understand the human experience of illness, such as pain or emotional stress. Doctors must interpret AI recommendations carefully and consider each patient's unique context. Ethical questions arise when AI makes suggestions that affect life and death decisions. Who is responsible if an AI system misses a critical diagnosis? Healthcare systems must balance innovation with safety and accountability. Regulation and oversight are necessary to ensure AI is used responsibly. Transparency is also important so that patients understand how AI contributes to their care. When used thoughtfully, AI becomes a powerful collaborator rather than a replacement. It allows doctors to spend more time on the human aspects of medicine, like empathy and communication. AI also accelerates research by analyzing patterns across millions of medical records. It can identify new disease markers or suggest novel treatment strategies. In the long term, AI has the potential to transform how we understand and manage health. It can help shift medicine from reactive treatment to proactive prevention. Imagine a future where routine screenings are guided by AI to catch diseases before symptoms appear. This could reduce the burden of chronic illness and extend healthy lifespans. AI might also help coordinate global responses to epidemics by spotting outbreaks early. By analyzing patterns in population data, AI could predict where resources are most needed. In this way, AI connects individual patient care with broader public health strategies. The integration of AI in healthcare is a story of partnership, not replacement. Doctors, nurses, and AI systems each bring unique strengths to the table. Together, they can make diagnosis faster, treatment more effective, and healthcare more accessible. The challenge is to implement AI in a way that is ethical, transparent, and inclusive. By understanding both its capabilities and its limits, we can use AI to complement human expertise. AI is not perfect, but it is an invaluable tool in the pursuit of better health outcomes. It demonstrates how technology can amplify human skill rather than diminish it. The evolution of medical AI is a reminder of the potential of careful, thoughtful innovation. It encourages us to ask not just what AI can do, but how it can serve humanity. In the end, faster, more accurate diagnoses are not about replacing doctors. They are about improving lives. And in this collaboration between human insight and artificial intelligence, we may be witnessing a quiet revolution in healthcare. The future of medicine is not a choice between man and machine, but a partnership where both thrive. With AI as an ally, we can imagine a world where fewer people suffer needlessly from undetected disease. And in that world, the promise of medicine becomes closer to reality for everyone.